Hello, this is Dr. Seema from Seema Health and Wellness. What I usually find, and over the many, many decades that I've treated patients, they really want to know a number of things about their particular case. And it usually boils down to these 5 questions that they want answered. And that's what we want to do through our first 3 to 4 visits. In other words, we not only want to treat you, but we want to educate you on exactly what's going wrong. So as time goes on, you can help improve your own condition. So the first thing that people do want to know is what's causing your problem? Why do I have pain, doc? The other thing is now, why isn't it going away on its own? People always ask that. They want to know, it's like, had pain before, it goes away, this pain just kind of goes away, comes back, and kind of comes back and goes away, and it's a back and forth battle. And they want to know what they can do, not only what the doctor can do for them, but what they can do to help improve their own health. And if need be, to help us correct the cause of their problem. They also want to know how long it's going to take. Some people basically think that, well, it's going to only take a few weeks. But in reality, these kinds of injuries may take many, many months. In fact, many times it may take many, many years to correct the cause of the problem. And then finally, how much is this going to cost? And that's very, very important, so that this way you understand before everything is even talked about that this is what you really want to do, you know how much it's going to cost, and you're going to realize how you'll be able to take care of the bill. And we're going to help you figure out the answer to every one of those questions. And as long as you feel that this is a good fit, and we feel that this is a good fit for us as well, then we can definitely continue on and become really successful about what's going on with your health. Well, what's the cause of physical injuries? Well, there's many, many causes, from falls and traumas to just general problems with your posture or your occupation or just activities of daily living. So there are many, many causes that lead to injury as well as disease, because we're going to discuss injury first, then followed by disease. Well, the causes of traumas to the body, such as sports injuries, falls, accidents, we've had them all. Regardless of who we are, what we did, we have had falls, we have been involved with accidents, and we've had sports injuries that cause trauma to the body. Activities of daily living, people don't realize that you're using your body 7 days a week, 24 hours a day, 365 days a year. And over the course of many, many years, and then decades, if you do not take care of your physical body, it starts to really break down, and you start to develop a lot of degenerative diseases that you can prevent. Now, those types of problems may not kill you, but it makes life a living hell. Your occupation definitely caused certain amounts of trauma on your body, whether it was being a secretary, whether it was being in construction, whether it was just being sitting around doing not much of anything, being on the computer. These particular situations have taken a toll on your physical body. Your weight. If you're 30, 40, 50 pounds overweight, that's a tremendous amount of extra weight on the structure of the body that's causing more and more damage to what we call the weight-bearing joints of the body. Posture. I watch people walk and their posture is, well, let's put it this way, deplorable. A lot of people walk like they're wounded. In fact, I've seen wounded animals walk better than a lot of humans. So your posture has been impacted by all these injuries, and it's basically distorted, creating more and more problems as you go on into your 40s, 50s, 60s, and 70s. Now, these conditions lead to pain, degeneration, and arthritis, regardless of what portion of the body we're talking about. Now, what we're going to do is we're going to really explain, although we just talked about the causes, now we're going to explain to you why it's not going to go away.